Your dental health affects more than just your smile. From hidden risks and fillings to the surprising connection between your teeth and overall health, taking a fresh look at your oral care could boost your well being. Let's explore how your health issues just might start in your mouth. And if you're new here, I'm Dr. Gayla Gorman, a licensed acupuncturist, naturopath, and author of What's Your Kryptonite? On this channel, I'm here to help you reverse the effects of chronic stress so that you can cruise through midlife and beyond symptom-free, so that you can put an end to common midlife symptoms like chronic fatigue, insomnia, mood swings, issues with gut health, and even weight gain. Let's start by talking about dental toxicity generally. So, it wouldn't be surprising, right, if you had toxicity in your mouth due to poor hygiene. But it isn't just poor hygiene that contributes to dental toxicity. If you brush regularly morning and night, you're really diligent about flossing, maybe even using a water pick like I do, that is not going to spare you from accumulated dental toxicity if, for example, you still have mercury fillings in your mouth, or maybe you've had extractions done. For example, I had extractions done whenever I had braces put on my teeth. And so if those extractions were done and all the material was not cleaned out from the extraction, it can leave essentially dead tissue to rot in your gums. Root canals are another big source of dental toxicity. Again, for a similar reason, the tooth is ground down and essentially killed, and a cap is put on it, and that dead tooth is accumulating bacteria. If you've ever seen images of the bacteria that is associated with a root canal tooth that's finally extracted, you'll understand what I'm talking about here. One of the people that really posts a lot of this kind of interesting information and even images online is Dr. Blodgett. He's a biological holistic dentist, and so you might look him up. He's really a fantastic resource. There's also an association for holistic dentistry. So if you're looking for a dentist that can give you a good assessment of what's going on in your mouth and you suspect potentially that there might be a correlation between some of your health issues and what's going on in your mouth, then you're going to need a dentist who practices this way. One of the things that a holistic dentist typically uses, either in addition to an x-ray or in place of an x-ray, is what's known as a cone beam scan. This is similar to a CT, so there is still some radiation involved. It's fairly minimal, but it gives them a much better picture of what's actually going on in your mouth and can identify things that, even if your dentist has taken x-rays and told you that there's no problem in your mouth, don't take that as the final word. You need a cone beam scan and you need an evaluation from a holistic dentist. If you're curious about dental toxicity, there's actually a chart that shows the organ association that correlates to each of the teeth in your mouth, upper and lower. And this is just fascinating. You can see this chart here on the screen, and we'll create a link to it below this video if you want to take a quick peek at it. But if you have any sort of health issues, it will be really fascinating for you to see which tooth that health issue correlates with, and then ask your dentist which teeth in your mouth have potentially had extractions or root canals or fillings other sorts of issues, and you will be surprised how often you find a correlation. Your dentist will have records of your entire mouth and what is going on there and the history. And so it's typically a quick phone call just to get information from them if you've been using a dentist for a long time. It can really help you tie your symptoms to a related organ or system. And in some cases, we find that even addressing the toxicity in a specific tooth is what's required to reverse some sort of health condition. So this should not be minimized. It is very serious. And for those of you who really have struggled with some sort of mysterious health condition that nobody seems to be able to get to the bottom of it, look no further than your mouth to find some clues that maybe have been missed in the past. Remember, digestion starts in our mouth, and if there's an accumulation of toxicity there, then looking for toxic stressors in that area makes sense. This is an example of one of the countless ways stress creates symptoms and other health issues, especially during midlife. I created a video that shows you how to eliminate these symptoms naturally, so I'll make sure to link to it below this video, but make sure you hit subscribe too, because I share a lot of tips when it comes to dealing with stress that's become toxic. Relieving the nasty symptoms stress creates makes cruising through midlife a breeze. So let's get back to talking about dental toxicity and what we can do about it. Like, what are some of the things you can do DIY, do it yourself at home? The first thing that I turn to deal with dental toxicity is food grade hydrogen peroxide. You heard me right, just regular old hydrogen peroxide. I do suggest that you get food grade hydrogen peroxide. You're going to have to probably order that. The food grade hydrogen peroxide is going to work wonders. You can dilute the hydrogen peroxide down to 3%. So if you order it, a lot of times it will come more concentrated, and you need to dilute it down to 3%, but you can swish that around in your mouth and it will really help with any bacterial problem, including infection, really help to manage any sort of toxicity that you've got going on in your mouth. Now, keep in mind that if you have dead tooth material from an extraction, from a root canal, if you've got toxicity from mercury fillings, then H2O2, hydrogen peroxide, is not going to solve that problem for you, but it is going to help you manage the infection to buy you a little time to find an appropriate practitioner to help you deal with it. Another little side benefit of using hydrogen peroxide is that this is a natural tooth whitener. And so you'll find that over time with consistent use, your teeth will just look whiter and brighter naturally. Now, again, don't have too grand of expectations if you've got a lot of buildup of tartar or staining. It's not going to really help you with that. But if you'll get your teeth cleaned really good and then use the food grade hydrogen peroxide on a daily basis, you'll find that your teeth stay much cleaner longer. So some of the cautions that should be sort of taken into consideration with dental toxicity are really knowing that you've got to have the source of the toxicity removed. This includes the mercury, the dead root canal tooth, any sort of flesh or residual from any kind of dental treatment. Another thing to really keep in mind is that when you have those mercury fillings removed, a lot of toxicity is going to be mobilized. And so you've got to use somebody who really knows how to capture that and keep that from going into your system and your bloodstream. A University of Georgia study of over 15,000 people found that those with multiple amalgam fillings had increased mercury levels in their blood. And this is really concerning because mercury is known to be toxic at high levels. It can affect all kinds of systems in your body and really be detrimental to your organs. The other thing to know is that when you do go to the dentist, even if you're just getting a normal cleaning, that's stirring up a lot of bacteria. Some dentists are even using hydrogen peroxide as a rinse now before a dental procedure. And so this is helpful, can be precautionary, but just know that it could be good, especially before and after a dental procedure, to really lean into this hydrogen peroxide use and really keep the bacteria levels down in your mouth. Digestion starts in the mouth, so there is naturally going to be bacteria in your mouth. There's a microbiome essentially in your mouth. So we definitely do not want to eliminate all bacteria. The good news is that hydrogen peroxide is really good at eliminating the bad bacteria and leaving the good bacteria intact. So it can be a really helpful, inexpensive thing to have handy in your home apothecary. And if your best efforts to live a healthy lifestyle and do all the things you've been led to think are supposed to work aren't getting the job done, you may even be feeling like you take 2 steps forward and 3 back. In my next video, I'll show you how to manage the toxic stress that's sabotaging your efforts. You can eliminate the symptoms that seem to be piling up in midlife naturally without medication, crazy diets, intense exercise, or any other unsustainable lifestyle hack.